Clean Nigeria Campaign Technical Committee, and is also the Honorable Minister of Water Resources. Honorable Minister, pleasure to have you again on Good Morning Nigeria.
Good morning, Nigerians.
Also here with us in the studios, Dr. Osagie Ehane is the Honorable Minister of Health. Honorable Minister, pleasure again to have you as well on Good Morning Nigeria.
Thank you for inviting me. My pleasure.
All right, and we also have Zaid Georgie. Zaid Georgie is Chief Water, Sanitation and Hygiene Officer at the Unicef office here in Nigeria. Zaid Georgie, pleasure to have you on Good Morning Nigeria. All right, I think we'll sort out that audio of Zaid Georgie once again. Just before we get into the technicalities of water availability, water supply, and all that, Honorable Minister of Health, our focus this morning is on hand hygiene and good health. It sometimes sounds so elementary. But we all often tend to, most often times, people tend to forget this critical linkage between hand hygiene and good health. Could you take us through this process again? What is the nexus between hand hygiene and good health, and therefore a healthy nation?
Yes, you are correct. People will sometimes tend to trivialize the importance of hand hygiene, but hand washing is a classical general hygiene measure for prevention of diseases and also promotion of good health. The hands are human tools, so to say, for various things. We use our hands for various activities, and in between some of these activities, you might have germs on your hands, and the washing of hands physically reduces the number and perhaps the types of germs you have on your hands, and could therefore save you from unintended or unknown infections. So hand hygiene and the washing of hands go together with good health, and that is the reason why they are being emphasized and promoted.
Well, Yusuf, there's a practical challenge with this. Honorable Minister, gentlemen, we're all here now. We all have our hands intact. Your hand is resting there. Honorable Minister, of course, you are clasping your hand. At some point, you would have freed your hands.
Maybe it's getting too conscious about it.
Yeah, but it is often said, that your hands are probably as clean as the last surface that you touched. So, how practicable is it to keep your hands? I don't want to use the word sanitized. How practicable is it to keep your hands safe from these pathogens that we all know that from time to time you have to touch surfaces and you are not sure, and these surfaces are not visible to the human eyes?
Yeah, you're correct. You cannot keep your hands away. As I said, the human hands are tools with which we do everything. We eat, we walk, we clean ourselves with our hands. So you can't do that. Luckily, the human body will be able to defend itself against a large number of germs or pathogens that enter our body. But there will be some that we cannot defend ourselves against, that we do not have either the antibodies or the cellular defense mechanism to take care of those germs. So we do get infected. But in real terms, the answer to that is to wash your hands frequently and then remove the pathogens that have entered your hands in the course of the day, some of them conscious, others unconscious. And that is exactly the idea behind it. And also in a way to be conscious of what we touch or where we touch, and to reduce the risks of getting your hands contaminated, particularly if you are in a hospital setting where you might have very resistant germs. But in a general setting, it is good to be aware of that, and washing your hands frequently actually supports your own health.
And truly, Minister, so let me dwell on you a little bit for a while, talking about the hands too, and then the hygiene thing. The washing itself. Now, this is an old practice that has been there for ages, but it so seems now emphasis is being laid so much on it now, so much so that even like today, October 15 has been set aside, global hand washing day and things like that. curious minds will always want to find out what really happened over the years. It's so much so that now a day is set aside for this, and people are being called upon to be conscious of their hands and be washing at least 6 to 9 times in a day or thereabout.
It's because of the consciousness of the importance of hand washing, and secondly, the consciousness of the fact that with regard to the coronavirus, we have very few other measures with which to be able to protect ourselves. There are no very clear therapeutics, and there is no vaccine, so you have to emphasize those measures that are available, and there is also not a very well-established population immunity. So a lot of people stand a chance of getting sick if they get infected by it. And not only coronavirus, any other kind of germs. Luckily, 80% will not develop symptoms, but those who develop symptoms can have very, very drastic threats to their lives.
We'll talk about the symptoms much later. Let's hear from the Minister of Water Resources. It's all about washing hands. And then it cannot be without water. But given the statistics, only 9% of Nigerians have access to basic water. And, washing hands need to be done under running water, clean water, not the ordinary water we use. Because I was discussing with a friend yesterday. It's not enough for you to just take a bowl, put your water in it and then wash your hands in it, and that's how wash it. No, it has to be under running water. And that running water is about the most scarce commodity now.
Well, I think the statistics, I think you're quoting probably are on the sanitation side, because the sanitation is very poor. The current national coverage for water supply as at 2019 is 71%.
71.
Yes. But of course, there's still a lot of work to be done in the rural areas. As at 2015, when the Millennium Development Goals ended, 50% of the rural population still didn't have access. Of course, in the last few years, from 2016 to date, we have brought out new initiatives to up the ante, to ensure that we improve on it, especially with the advent of the Sustainable Development Goals, which is looking at a target of 100% access by 2030. So we're working on that with 2 key programs: P-WASH, Partnership for Expanded Water, Sanitation and Hygiene, and the National WASH Action Plan. But yes, you need running water, and that is why it is very, very important that we even before the COVID-19 came, we've been promoting this, trying to ensure that we get 100% coverage. So, but you should understand that there's quite a lot of challenges, especially you mentioned that water is a concurrent list, and the bulk of responsibility for providing water to the people in their households on their taps rests with state governments. Unfortunately, not much has been going on in the last 20, 30 years there, because 2 reasons. One, maybe the political will is not very strong in some states. They are not prioritizing water and sanitation. And secondly, water is a highly capital-intensive venture, providing provision of water supply. And I think because of that, and the fact that also, provision of water supply, especially for municipal water, is something that, the process takes a long time. You have to do the planning, then you have to start doing the, you get the source, the treatment, the distribution, and you have to continue because the population is rising. They have to, you just have to keep going. So it's becoming, it has become a major challenge, I think, to states in the last 20, 30 years. But what we've been trying to do is doing a lot of advocacy through these 2 programs to ensure, to get the states to really begin to invest more, to make water and sanitation a top priority, because it doesn't make sense. You have all these edifices, buildings, you have street lights everywhere, dualized carriageways in towns, so much vanity, when the basic building blocks of life, of which water is number 1 or number 2 after air, are not there. So I think we need to refocus. The priority of our investment, especially at state level, should be more towards water and sanitation, so that once you've cleared the basics, by providing the adequate water supply, you already sorted out a lot of your health challenges as well. Also, you're promoting education in a way, because we also know that there is a connection between water, sanitation, and education. Menstrual hygiene, for instance, lack of toilets in schools and so on, that makes it difficult for girls to go to school at certain periods, you know. So the focus is we must continue to invest more, much more in water and sanitation. If we all, as a country, all the 3 tiers of government, go by the books with respect to the WASH action plan that was launched by the President in 2018 and the declaration of state of emergency, as well as the PWASH program, which is essentially to support states to meet the rural water needs of the people, then I think we're on course.
Well, Honourable Minister, we've had you on Good Morning Nigeria a number of times, and it's just a couple of years since the launch of the WASH campaign and the declaration of a state of emergency. We discussed all of that. But what is the status report today that we are observing the, shall we say, the Global WASH Day?
Well, I'll tell you honestly, as far as sanitation is concerned, it's dismal. It appears Nigerians are still not paying attention to hygiene, personal hygiene practices. The statistics tend to show that we have a little dip. Although this figure was for 2019, I believe because COVID-19 has not allowed us to take the statistics for 2020, but with the general awareness now, because of the pandemic, I believe there's more consciousness, there's more awareness as far as hand washing or other hygiene practices are concerned. But we have done a little bit better in terms of water supply. Like I think in 2015, the national coverage about 68%. As of 2019, it has gone 3 notches up to 71. And we hope that it will continue. We are very optimistic because now we've been seeing many states declare following the suit of the federal government of the president. State governors are declaring state of emergency on WASH in their states. I think recently we had Enugu State, Kwara State, and quite a number. So we're like getting to about 20 out of the 36 states that are following suit to declare a state of emergency in water, sanitation, and hygiene, and that means they're also putting more money into that sector. So I think we're making progress, but slow progress nonetheless.
What were the components of the state of emergency on the water sector so that we know what the markers should be, and when we are taking them off and saying, okay, we've done well on this, we haven't done well on that. What was supposed to be accomplished under the state of emergency?
Well, I think I think there were 5 pillars, but the most important one is financing. To be able to, political will, so that somebody at the top level of government, somebody is really in charge and driving, and that means the political leadership should be at the top. That is one thing. The second major thing, I think, is financing. The other things are technical, but I think these two are quite critical. And like I said, this is what we use so far, in addition to getting to know the number of populations that has been served, from the baseline. We also see what is the political commitment at the state level, and that's one of the ways we measure. But there are quite specific actions that the federal government should do, the state government should do, and the local governments. And like I said, if we follow these specific actions religiously, I think we'll be able to make it. But again, you should understand there are 3 tiers of government, and each one has its own responsibility. At the federal level, we're doing our best. Many states are also doing what they can, but there are also many states that are still not, in my view, are not doing enough. And if they're not doing enough, I don't see how they can meet that target. But we'll see how things go.
Well, Mr. Suleiman, it seems that you have so much on your hands and so much on your table. Water is life because it is almost everything. And its scarcity, points to the fact that a lot more needs to be done in order to have so many things in place. We'll get back to that much later as we continue because, as you mentioned, local government, state government, and federal government, all these have to sync together in order to have things working. Minister of Health, can we get to the details of this hand washing thing? It's banal, it's ordinary, it's simple, it sounds easy. But emphasis is really on it, so much so that people have to really take up the challenge and do it in order to, run away from these issues. So can you take us through what is hand washing, really, properly put? What are we going to wash and how are we going to wash it?
Well, hand washing is to, in very simple terms, clean your hands. If you're coming in from the farm, for example, or you're coming from using the toilet or the restroom, definitely your hands, you must assume, are in one way or the other contaminated. And by washing your hands thoroughly, the recommendation now is that it should not be less than 20 seconds as a recommendation. You physically remove not only the dirt, but we presume a large percentage of the germs that you might have on your hands. The germs, of course, are not visible, but we assume that they are there. And if a large number of them are pathogenic, that is to say that they can cause illness, then you are at risk of getting an infection. So the actual physical washing of hands is reducing the quantity of germs that you can have on your hands that can enter your body. And you also know that with regard to COVID-19, we mentioned don't touch your face, don't touch your eyes, don't touch your nose, don't touch your mouth, because these are the avenues with which whatever is on your hands could immediately enter your system. So apart from washing your hands, don't touch your eyes, don't touch your nose, don't touch your mouth. So those are ways of reducing the risk, and the emphasis is particularly high here because we have very little other solution to someone who has got a very nasty infection of COVID-19 or any other pathogenic element.
Okay, thank you very much, Dr. Yohanire. Now, earlier we were trying to introduce Zaid Georgie, who is Chief of WASH for Unicef in Nigeria. WASH, of course, stands for Water, Sanitation and Hygiene. Zaid, we've had you on Good Morning Nigeria in the past, also discussing issues around WASH. But tell us, since the state of emergency was declared in Nigeria, what is it that UNICEF itself has been doing to facilitate the attainment of the goals or the objectives around the WASH agenda in Nigeria, and what has been the outcome?
Good morning again. UNICEF has been working in the country for quite a long time, and of course our role is supportive. UNICEF is, the work that we do is meant to create good, successful examples that could be taken to scale and replicated. Let us not forget that one of the huge challenges in Nigeria in meeting any target is the number of population. We're talking about 200 million people. And in WASH, for example, to make any move, increase in access to water, for example, the number of people gaining access in any specific year will need to be around 5 million people. So we're talking about a big scale. And of course, this big scale is not meant to be covered by any single entity. As I said, UNICEF is support. UNICEF's role is supportive. The ministry, there's a ministry at the federal level who is in charge more of policies and roadmaps and things like that. And then the implementation happens at the state and at the local level. Now, when we look at the WASH problem in general and in a comprehensive way, this is an issue that has to be dealt with by all Nigerians. They will need to work together in harmony. The authorities will do something, but the people will also need to play their role. There's a lot that needs to be done. Any capital investment, of course, will be taken care of by the federal government, by the state government, but running those systems, making sure that they perform, that they are sustainable, that they deliver, has a cost, and the cost will need to come from somewhere. Paying for a tariff, for example, to run the water systems that are being installed is a necessity. And when we see the figures, I mean, number of people who pay tariff is less than 10% around the country. Again, construction of household latrines. This is something that will need to be taken care of by the people themselves. The figure here, we still have 1 in 4 people in Nigeria who defecate in the open, and this is not acceptable. Of course, now India was number 2 in the world, but with the progress that, Nigeria was number 2 in the world. With the progress that India has achieved, Nigeria is coming close to the spot number 1. This is something that will need to be taken care of so that those figures could start to come down. And again, it's not a matter of a declaration of an emergency happening in 1 or 2 days and then we leave it. This is something that will need to be dealt with consistently. A lot of leadership is required. The Honorable Minister of Water alluded to that. What happens at the state level will need to continue. I mean, there will need to be follow-up. There will need to be more allocations to the sector. And at the same time, the leaders will need to talk to their people, show them what the problems are, discuss with them what are their needs, and these needs should be dealt with. So it's a collaborative work, and without doing that, those targets will never be achieved. Of course, our yardstick is the Sustainable Development Goals, which is happening in 10 years from now. 10 years is not that far in terms of development. And in addition to that, Nigeria has committed itself to achieve an open defecation-free country by the year 2025. And this is happening in 5 years from now. We need more to happen, and we need more collaboration. And of course, we always say that Nigeria is one country uniquely positioned with lots of resources that will need to be further explored. The country has water, the country has land, and the country has, and especially when we talk about development, the private sector. The private sector is an asset within the country that is unfortunately yet to be explored. They could be utilized, they could partner with the different governments, and the government's role will be to regulate, and the work will be done by the private sector. We will get a good quality service. Private sector is known. Of course, they make profit at the end, but they are known for their efficiency, for their effectiveness. They do things differently, and they have qualities that are not available within the public sector. This is an asset that will need to be explored.
Well, Zaid, still with you. Thanks a lot for your opening comments. In part, you said part of the challenge of accelerating the gains of the WASH program has to do with Nigeria's population, around about 200 million. Well, Nigeria isn't more populous than India, and yet you have indicated that Nigeria now stands, shall we say, the risk of overtaking India and then becoming number 1 on the sanitation aspect of WASH, namely open defecation. What is it that India did right or is doing right that is missing here?
India has done a lot, and I think this is recognized by Nigerians, and there has been a lot of exchange of experiences. There was a delegation that went from Nigeria to India to learn about this aspect, to learn how did it work, what is it that Indians had to do that needs to be done here. India started from 2014, and it was, they made this as a focus to end open defecation. And they have managed to achieve a lot. I think open defecation in the rural areas in India now has come to zero. The Honorable Minister is fully aware of that. He has visited India and has learned a lot of their experience. Now here, I do not want to single out open defecation. Really, when we talk about, and today is Global Hand Washing Day. There is more focus on hand washing than before because it's the COVID-19 era. WASH has those 3 sub-components: water, sanitation, hygiene. Without having the 3 together, we are fooling ourselves. Nothing could happen. You cannot wash your hand, and I think this was alluded to. If you don't have water, you cannot wash your hands. If you don't have a toilet, then you will continue to pollute the environment, pollute the water sources, and the vicious circle of pathogens will come back to us. And then if you don't have a hand washing facility, again, you cannot practice that. What is happening now, I mean, we tell people, because, and again, I mean, we need to take advantage of the COVID situation. It's a challenge, but we need to capitalize on it so that we continue with what has started. Nigerians, based on the survey that the Honorable Minister alluded to, I mean, this is something that is done jointly between UNICEF and the Federal Ministry of Water Resources. Those who know the critical times when hands will need to be washed are about 81% amongst all Nigerians. Now, when it comes to the practicality of it, demonstrating that hand washing is known to them, they need to know how to do it exactly, as alluded to by the Minister of Health, washing it under running water for 20 seconds with soap, the figure drops down to 10%. When it comes to the likelihood of people doing that, and this is taking into account the availability of hand washing facility within the household, the figure drops to 4.6%. When we do communication campaigns, we will need to study those elements very, very accurately and very closely, so that this campaign, the message that we send to the people, will need to be designed according to their knowledge, according to their attitude, and according to their practice. And what has started now will need to continue. It will need to be more comprehensive. And we will need to study the situation and adapt the message so that we can achieve the anticipated change. Without this happening, I mean, the challenges will remain to be there.
Zaid Georgie, thank you so much for those comments and insights. I don't know who to put it to among the ministers here. He mentioned, most importantly, the peer review issue. We're trying to make progress in trying to see that we don't really catch up and become the first ahead of India. And he mentioned that, of course, Nigerian officials and delegation were in India in order to see how things work there, and then had maybe come back home and they see how it can be implemented. Now, I don't know. Minister of Water Resources, were you among the delegation or was the ministry part of it? And if yes, what did you see and how did you approach it?
Well, my ministry is the focal ministry dealing with the issue of campaign against open defecation and all issues related to sanitation and hygiene within the context of the Goal 6.1 and 6.2 of the Millennium Development Goals. So we are the focal ministry. Yes, I was in India, and yes, we've already, if you've been following our activities, specifically on 19th November 2019, we launched a national campaign against open defecation. It was launched by the Vice President on behalf of the President. We have a steering committee chaired by the Vice President to promote this campaign against open defecation. The following day, on the 20th of November, President Buhari signed Executive Order Number 9, making it a duty that we should end open defecation by 2025. And there are quite a number of other issues. Setting up the campaign secretariat, charging all government institutions to provide toilet facilities, adequate toilet facilities, charging commercial entities to provide public toilets as and where necessary, requesting state governments and the national legislature to provide legislation, some form of legislation within their jurisdiction towards ending open defecation and lots of other things. So we have done all the major things that India has been trying to do. We have exchange programs. We have some experts from India that we're working with. We already launched the campaign secretariat way back on 28th of May 2019, a day before a day or two before I left office, under the first time of this administration. The campaign is there. The secretariat is working full time. We're working with National Orientation Agency. We're working with the media. Recently, I think Stephanie, one of the Nollywood actresses, was with us. We have appointed many WASH ambassadors, just the way India has been doing. They worked with Bollywood. So we're working with everybody. We're working with the private sector. We've created the organized private sector for WASH. We're working with the Nigeria Diaspora Commission on a campaign, Operation Flush It, they call it, and that is it's aimed at getting the diaspora, Nigerians in the diaspora to support the building of toilets, especially in education and health institutions. So many things are going on, but we, I think we were a bit, hampered by the lockdown of the COVID-19. But as I'm talking to you, we started with one local government. We're using the local government as a unit. We have thousands of communities, thanks to Unicef, Water Supply and Sanitation Collaborative Council, and efforts within the ministry. We have thousands of communities that are open defecation free, but we have been taking the local government as a unit. We had the first local government that was open defecation free, Obaliku local government in Cross River State. We celebrated that in April 2017. As I'm talking to you, we have 27, when we are in the process of validating around another 10, and hopefully much more before the end of the year. A little less than the target that we have, again, like I said, because of the lockdown, but hopefully we'll step up future. So a lot of things are going on. We have borrowed much from India, and the truth is, basically, it's just that it's not official, but I think Nigeria is basically the #1 country now practicing open defecation, because we don't have 46 million people in India that are practicing that.
All right. Thank you very much, Minister of Water Resources. Let's come back to the Honorable Minister of Health, Dr. Sagi. And one of the comments that your brother minister made earlier was that, look, Nigerians are not paying sufficient attention to personal hygiene. If you reduce this to just say hand washing. He also listened to the data read out by Zai Georgie with regard to say, okay, in terms of awareness, probably around about 80 or 81%, but in practicality, the percentage drops, and then at the household level, it becomes single digit. What, in your view, is probably missing? Look, Nigerians dress well, Nigerians like to eat well, and yet we don't appear to be ready or willing to take care of our health by just simply washing our hands. What's missing?
There are very many factors that are missing. The health sector is the greatest beneficiary of a successful WASH campaign, and that's why we work very closely with Ministry of Water Resources and also with Ministry of Environment. But to look at your system, we have to use hypothesis. I believe that the communication is something that needs to be strengthened, and that is why in many of our programs at the Ministry of Health, we involve the Ministry of Women Affairs, because that ministry functions a lot with women, with households, and with families, and I believe they are the de facto family affairs ministry, and to a large extent can influence social behavior, and can also be very helpful in social and behavior change communication. Delivering messages of that nature has to be explored. We have to look at it again. So open broadcasts and so on, they work. But I think they have a limit, and where we need to now probably look at changing tactics. Is it, what does the average citizen take more seriously? Is it the message from the pulpit, or from the mosque, or from the traditional ruler, or from the politician? Where does it sink in more seriously? If we look at it that way, we can perhaps better communicate with the people and make it clear to them that these practices are not good. The damage that can be done by poor domestic hygiene, poor environmental hygiene, those are things that will be emphasized by the health sector. But again, with regard to provision of water, that is again public sector, which has to be blended with what the private sector can do. But by and large, I think we need to re-examine our communication strategy. Do we reach the people? We are talking to them, but are we really getting across? And is the message getting across? Do they understand? Do they value what we are saying? some of the advice we take is almost like a joke. And if you present a message like a joke, people will take it as a joke. So I think there must be some more serious delivery in a way that people will have more impact. Many of our people rather follow taboos rather than laws. So if you make something a taboo, perhaps they will take it more seriously. But if you make a law, probably not so much. It's a matter of culture also. There are countries where they look at the law, but they don't care about taboos. But I think in our environment, taboos are actually taken more seriously. And you have to adjust your message in a way that it gets across to the people, no matter which measure you need to take. So I think that the benefits for the health sector are such that we would like to join in the messaging process because reducing disease burden is a primary mandate of the Ministry of Health.
Okay, thank you, Minister of Health. Earlier in the program, we've been thinking of getting across to the British Deputy High Commissioner, and now it seems she's ready for us, and we really need to get her on board. Jill Atkinson, you welcome to Good Morning Nigeria. Can you hear us? Jill, are you there? We welcome you to Good Morning Nigeria.
Good morning. I'm really pleased to be here. My first time, but hopefully not my last.
Sure. Now, why is the Global Hand Washing Day important for the United Kingdom? And what has been the government's involvement with countries like Nigeria, especially on, wash over the years now?
It's such an important year. I think previously, Global Hand Washing Day has sort of been seen as a technical issue, a side issue. But the presence of the honourable ministers, the amount of time you're devoting to this, and the overall profile of this year just shows how fundamental hand washing is to our basic health and sanitation. For the UK, we are working together with international colleagues to host a major event at the United Nations. But really what I would like to do as I talk to you today is bring this home to Nigeria. Hand washing is so basic to sanitation and health. Obviously, the COVID pandemic has brought it to the fore this year. And for us in Britain, we are relearning lessons about hand washing and sanitation that perhaps we forgot, to be honest. But in Nigeria, whatever happens with COVID, and your record on COVID is very different from that we have in Europe, hand washing, sanitation, clean water are fundamental to the health of your children. Access to water, access to hand washing facilities, and a culture that says this is the thing to do. And
Seems, we're having problem with the signal from Jill there. We'll get back to her whenever we're through that challenge. Minister of Water Resources, get back to you and then see how you're handling the issues at the, at your own level, talking about the challenges you have. Now, when we look at the situation at the moment, a lot needs to be done with regards, providing water generally. And that seems that you have to really go beyond limits sometimes in order to reach multitudes of Nigerians all over this country. You've gone to India, you've seen it, and you've seen how it's been done, the wash thing, and then the open defecation thing, and how the strategies are being worked out. Back home here, the challenge is not as much as the population we have in India, because as you said, 46 million. Here we're about maybe not up to that. What exactly are you putting or making differently in order to address our own challenge, peculiar challenge here?
Well, you see, India took out 550 to 600 million out of this practice of open defecation. We in Nigeria have just about 46. It used to be 47 million, but the recent statistics show that at least through our recent step of the campaign, maybe another 1 million people have been taken out of that practice. India has a federal structure like our own, have similar cultural settings, have a huge rural population, rural-urban migration, and so on. We all had a lot of things in common, but I think the first thing is the political will. The states were able to key into the whole thing was driven by the federal government from Delhi, and all the states. I think, what do they call them? They are, well, not governors, but I think they call them regional ministers or something like that, or first ministers. I can't remember. They virtually all keyed in and took over, and then the communities also saw it, and the advocacy was so intense. School children, the entire society was mobilized. And that is the kind of thing that we're talking about. In one of my interviews or two recently, I've said, once Nigerians catch up with this idea of sanitation, basic sanitation and open defecation, it will be on autopilot. The whole thing is for the citizenry to accept. And I agree with Zaid, what he said, that the whole country needs to come together. So it's not about the president in Abuja declaring this or that. This thing is not only not to percolate, but to cascade rapidly down to subnational level. And that is where we need the political will at state level, and then for them to be able to carry the local authorities, the traditional institutions, the religious, institutions. Everybody has to be on board for that to happen. And that's essentially what we're trying to do. So we're also training volunteers now. We're trying to get volunteers because this is not something. I think Nigerians should be wary of. Should see this campaign as not one of those projects that government is dishing out money, because this is something that affects you personally. I keep saying, people should wait and think, how much are you spending on phone credit on a daily basis, and how much are you spending on water? And if you had to just pay for municipal water supply, maybe 1,000 or 2,000 a month, and the benefits that you accrue compared to just talking on the phone or chatting or
other forms of communication.
Exactly.
Yes. We'll return to that presently, Honourable Minister of Water Resources. Well, a moment ago, we saw the British Deputy High Commissioner again rejoining us via Zoom, Jill Atkinson. You are Deputy High Commissioner. You were talking about the significance of hand washing, of course, under the COVID-19 environment. But tell us, in relation to Nigeria, what exactly has the British government tried to do in terms of? We know that your DFID does a tremendous amount of work in various areas, but what is the focus of the British government in lending support, if any, to Nigeria's WASH program, more particularly the sanitation angle?
Yeah, so over the last 10 years, the British government has invested over £100 million in the WASH project in Nigeria. This has been a significant part of our development work in partnership with the government and with international organisations in Nigeria, as well as work that we're doing globally, which is continuing. I think, though, for me, the issue is we can help, we have been supporting, we can seed issues, but it's about changing structures, systems and relationships within Nigeria. So it is not acceptable to build a school without basic sanitation facilities. Business owners must be responsible for providing basic sanitation facilities within their business. And it's also about culture. It's not just about having the facility. It's about people understanding the need to use those regularly, and sanitation and hand washing becoming part of for all parts of society. And what I think is really important is that this isn't just owned by the federal government. Important role of ministers is in this, that it needs to work through the layers of government down to state and LGA level, but also the role of small business, but also the large businesses here in Nigeria who provide expertise and products that mean that sanitation can become a basic part of life. So I would really encourage the two issues of culture change and partnership to develop change here. And the work that the UK practicalities of a tap, it's been about changing that culture, structure and systems to mean that this is a fundamental part of life. And that's the responsibility that has to be taken both by government but also by business here in Nigeria.
All right. Thank you very much, Deputy High Commissioner. We're going to have to pause you, even though your Zoom connection is unstable. I want to bring in again the Unicef Chief of WASH in Nigeria, that's Zay Georgie. Zay Georgie, I mean, listening to the comments, there is a certain undertone that besides the federal government, the subnational entities have a great deal of role to play in cascading down the message and, of course, ramping up with the WASH idea. What do you find in your course of work in interacting with subnational entities, that is to say state governments and local governments? I mean, we hear about political will, we hear about financing or funding or collaboration. Are you satisfied with the response you get from state governments, or what more would you like to see at those levels of our governance structures?
Well, we've been working closely. When it comes to the real implementation, everything happens at the state level and at the LGA level. As I mentioned, work at the federal level is more for policies, data, directions, and things like that. And we have quite a lot of successful experiences. We work closely with authorities, and we work closely with communities. UNICEF focuses on rural areas, and most of the work that we do is happening at a rural setting. In a rural setting, of course, because of the nature of, the administrative structure here, we have the LGA, but between the LGA and the communities, there is nothing. Unlike education, for example, there is the school, which is in the middle. Unlike the health sector, whereas the PHCs are in the middle. Here it's LGA, and then there's a big gap, and we have the community. So the focus of our work has been to deal with the community. The first thing that we do is establish a so-called WASHCOM, which stands for WASH Committee. Committee selected people from the community. They make the selection themselves, and they will be in charge of running the system, taking care of the hygiene aspects, making sure that the water resource doesn't get contaminated. And they are able to undertake simple repairs. And of course, they are usually mandated to establish a tariff system to collect contributions from the community so that the systems could be maintained. Anything that is slightly more complicated than that, they do the connection with the local, with the LGA. There is a system called VLOM, Village Level Operation and Maintenance, by which they could get the help they need technically to fix their systems. Now, when it comes to sanitation, we follow the community-led total sanitation approach. Again, it's to sensitize the communities so that they will go and construct their latrines. Again, the cost here will need to come from the people, and they pay for the latrines when they are convinced that construction of a latrine is something that they will need to do. And for that, there will always be people who cannot afford. So there is a system that has been created, which is called the Sanitation Financing. Sanitation Financing, the financing will either come from the community itself, or it will come from microfinance institutes. Microfinance institutes will loan to the people, and then they will get it back. The problems that we were facing is that loaning is happening with a high markup rate. Now some of the states have recognized that, and they are putting money, which is called the revolving funds, so that people could borrow at a reduced rate. Now here, I don't want to go into so many details, but I'm saying that when there is a will, there is a way. We need to do things. As we mentioned, the political will at the federal level is there. It has to cascade. It has cascaded in some places, it has not in other places. Now, cascading will need to be consistent. It will need to be continuous. There will need to be some levels of accountability. do this, and then after a week or 2 weeks, we review what progress has happened. Why there's no progress? Are you facing problems? Let's resolve them together. This is how work is done. If this is not happening, I mean, the country is huge. The sector, as simple as it may sound, I mean, it needs some thinking, it needs some commitment, it needs some common sense. That's it. And again, we have to bring all the people with us. We will have to bring the private sector. When this is coming together, the force that it will generate will definitely push the figures upwards, and Nigeria will then be able to meet its targets. Anything less than that, I mean, I'm afraid to say that the challenges will only grow bigger.
All right, Zaid, thank you very much. Just before we take our break, Yusuf, listening to the two honorable ministers with us here in the studios, that's a pertinent issue that arises. Minister of Water Resources has sometimes spoken about the challenge of delivering potable water to users in municipal locations, because that's the responsibility of state governments. And Honorable Minister of Health, we also had you on Good Morning Nigeria. The federal government has been driving the PHC program, which is the Primary Healthcare Center idea. But the level of progress from reports that we get from time to time is attenuated by the fact that you don't get either the buy-in or rapid access by state governments to help escalate the availability of services or even structures for primary health care. What usually is the challenge with the federal government taking on an idea and then trying to get state governments to buy in and then run with it? Why do we always have that challenge? I mean, primary health care should be the responsibility of subnational entities, but federal government has taken upon it. WASH, at some point, I mean, as we are saying, should be the responsibility of subnational entities, but it's more of the federal government that we continue to hear. I don't want to get back into whether governance is failing at some levels, but just what is the challenge? You have the National Council of Health, Honorable Minister of Water Resources, you have the National Council on Water. What happens?
And even in addition to that, the bottom line seems like the political will is missing, when you get down, state and local governments. Now, against the background of what he said and the question he asked, how do we address this issue of political will so that we can get things going at those levels?
Well, first, very simple answer is through advocacy. Advocacy with the subnational authorities, the state governments and the local governments and the commissioners also. But I think there is also a very important need for understanding the strategy. The Ministry of Health has its own strategy for the health sector, and communicating this to the subnational levels, which actually you would assume that they already know, is not always that easy. The state governments we see have an interest in constructing large hospitals, because they are more visible. They think that they are more politically impactful. In reality, what we are looking for is the very foundation of the health sector, which is the primary healthcare center. It is the most important platform from which a large number of services can be rendered. But the interest in that level, that state level, and also local government is not that strong, because these centers are small, they are not so politically visible, and at the end of the day, the large structures that have been built are not usable, because you already have a federal medical center, you have a teaching hospital, and it becomes a duplication, a lot of white elephants around. So we're trying to draw attention to the importance of the primary health sector as a foundation of healthcare delivery, and from which you can take care of 60% minimum of the disease burden. We can also use that platform for education, for skilled bed attendance, for immunization, a large number, even for taking care of HIV, tuberculosis, malaria, a large number of services that can be rendered at that level. So the federal government is the one drawing attention. We are starting a new approach. Within the next 2-3 weeks, we are going to have a primary healthcare summit, in which we want to draw attention to the importance of this level of healthcare delivery, and to also invite partners to join and bring in our ministerial colleagues, the Ministry of Water Resources and Environment, and also Women Affairs, to draw attention and resources to the primary healthcare level. We want to have one fully functional primary healthcare center in every political ward. And by functional, I mean it must be able to give service around the clock. It must have solar power, it must have water, and it must have staff quarters. That's a new design, which we are also trying to get the National Assembly to key into, because it's a favorite constituency project. But a lot of the structures that they build are not even usable because they do not follow this design that the ministry has set up, and they are also located in wrong areas. If you locate something in the bush, people will not go there. So we are trying to create a better working relationship with National Assembly, with the state governments and local governments and our partners to key into this sector, which we believe will take us faster and closer to the sustainable development goals for the health sector.
I'm just wondering, Honorable Minister, thanks. You've given a tip and a hint that you're having a summit on primary health care. Yesterday on Good Morning Nigeria, our focus was on mental health. And part of what emerged from that conversation had to do with in the views of the experts, the apparent neglect of mental health in terms of policy framework and all that. And there was an argument that indeed mental health care can be incorporated in primary health care. We're not going to get into details of that, but I hope you have that as a takeaway so that in structuring your summit, perhaps you may wish to consider that.
Yes, very clearly, because mental health is one of the neglected topics, and it definitely is going to be included, and as well as many other things, because the primary health care center offers a fantastic platform from which to render a huge panel of services to citizens that will take the pressure away from teaching hospitals, from general hospitals, and address the needs of our country in the best and cheapest way.
Minister of Water Resources, I don't want it to sound like a broken record with the fact that, look, you provide bulk water as federal government, reticulation ordinarily the business of subnational entities. All over the place you're having these complaints of access to reticulated potable water supply in our urban centers. How we keep talking about the absence of political will. How can that be engendered? I mean, can it be a political party resolve to say, those of us who belong to this political party, this is what we are going to do, and then we march with it, and then of course others can then begin to get on the train or seek to imitate what is happening. Why is that political will apparently lacking or altogether missing in a number of subnational environments?
Minister, before you get into that, it seems the political will thing is a hard nut to crack. And it seems it's going to take us a few minutes to do that. So we just ask you to pause for a while. We'll take a break now. You're watching Good Morning Nigeria. We'll take a break now. We're back with more on global hand washing today, October 15, as we discuss this very important issue. Stay with us.
A new edition of TV Guide is out, featuring great personalities from all walks of life. Expository interview with a young TV presenter who shows passion on what she does, Morayo Afolabi Brown of TVC. Pick a copy of this compendium of mind-blowing stories and get abreast with issues as regards media convergence, leadership, health, star profiles, star programs, fashion, sports, human angle stories, and lots more. Meet some media professionals within our space who have paid their dues in no small ways. TV Guide, very incisive, very educative and compelling. Grab a copy at the vendor near you or NTA stations nationwide. TV Guide, your indispensable companion.
All right, welcome back. It's still Good Morning Nigeria live on NTA's network service. Honorable Minister Engineer Suleiman Adamu, please take the question I asked before we went on a short break.
Yeah, well, it doesn't necessarily have to be a party thing. It's a leadership thing. If you are the leader, you are the chief executive of a state, or you are a representative of your people, you need to know the things that need to be done. The problem with this country, I think, is that we like to run before we crawl, you know, and it cuts across the entire society. You can see that a lot of times people ask me about certain things, and it seems they don't even know all the things we've been saying about water and sanitation because it is not important to them. Probably because it's an elitist society, so they prefer to hear things. If the Abuja airport is shut down today, for instance, you see headlines everywhere in the media. But when it comes to issues like water, sanitation, basic health issues, you don't hear them. The issue is we need to go back to the building blocks. You can't run a society, you cannot be investing money on airports, on this, when your people don't have the basic needs of life. They don't have basic education, they don't have basic health, they don't have water supply. I think that is the key to the whole thing. We need to plan. Even if you have a political will, you also need to plan. How many states have a development plan? Really? You know? Or I ask many states when they come, I say, do you have a water supply master plan? You have to have a master plan. You have a plan, 20, 30-year plan for your water, for your health system, because everything is dependent on the population. Every day you register new births, probably much more than you register new deaths, you know. But all these have a future, and you need to factor in your development these people. So the whole thing is organic. Whether it's health or water, it's organic. You have to plan the basic infrastructure, and you have to continue upgrading. You have to continue improving and upgrading and sustaining, and make sure that the services are going. So I don't think it's something that can say, every political party has a manifesto.
But it's so Minister Kingsley, when you look at this whole thing, these are politicians, right? And whenever they come on podium, since 1960 to date, it's all about providing water, providing health facility, providing education. And all these things have been there for the past 60 years.
Yes, but the minister
but 40 years ago, the system was
elephants.
better. I'll admit that 40, 50 years ago, the system was better. We had better focus. We had better planning, you know.
That is why I was headed. Because in some of our interviews we conduct with people, especially those that are above 70 and near 80 or even more than that, they say that water in their own time in the 50s, 60s, into 70s was all over the place. And it so happened today, none is there to drink, and not much is there to drink, let me put it properly that way. And today we're talking about water, you know, in relation to washing hands ordinarily, and it still is a problem.
Well, the key issue is that in the last 30 years, there has been a serious problem associated with investing in water. States stopped investing in water. That's just the issue. If you see most of the major municipal water schemes that we have in the country today, they were built maybe 40, 50 years ago. Very few you'll see within the last 30 years bracket. And if you see new ones, they're probably borehole based, because they have been looking for quick fixes. It's easier, it's faster to drill a borehole, but it's not sustainable for a city. Borehole projects, you know, to do a borehole is okay for a small community, for villages and so on, but you cannot sustain a city like Abuja or Kano or Kaduna or Lagos on boreholes. And there's so much water around. If you go to Kaduna, there's River Kaduna. If you go to Kano, there's River Chalawa and River Kano. In Lagos, you have Ogun River that is providing water. There is more than enough raw water for most of the major cities. There have been instances where the federal government built a complete system from the source, at least to the treatment, only for the states to now take up the issue of the distribution, and they have not done so. They have not invested. So the key thing is, I know for instance, of a city that, as a consultant, we designed a project, the water scheme for the city, for the town, the state capital was going to be about 7 billion naira in those days. But the government went ahead to build an airport for 13 billion. So what do you say to those kind of things? You know? So we need to understand, we need to start from the basics. We need to understand that those basic things are the most important.
Very important. By the way, do we have advocacy groups such as we have for human rights and other things that can, as it were, generate more opinions, generate more interest in this subject matter? Earlier you mentioned, and it's a very apt example, if you were to shut down Abuja International Airport, that's Nnamdi Azikiwe International Airport today, it probably to be a topic for us on Good Morning Nigeria tomorrow. And then, of course, the headlines all over the place. But water, sanitation and hygiene, we'll focus on it on Good Morning Nigeria, but we don't appear to hear a great deal of NGO advocacy on this aspect. Is it that we just take it for granted so that subnational entities will not say, oh, right, this is an investment outlet, or this is an area we ordinarily should focus on? I wonder sometimes, and I'm sure, gentlemen, you also have that consideration. When you see all these roads that are being built in urban areas, they say they are dualizing roads, I say to myself, all well and good. I mean, people clap for you when you commission those roads, but the time is coming when those roads, those same roads, will have to be excavated in order for you to lay pipes for reticulation.
Absolutely.
So I need reticulation to get water to people. So I don't know. It's an issue that we'll focus on. Let's see once again if the Zoom connection to Jill Atkinson of the British High Commission is back to us. But Deputy High Commissioner, once again, we'd like to invite you into this conversation. You made some significant points, one of which I recall, and I'd say, look, we need to change structures, we need to change relationships, and at some point affect cultures. How much of a barrier is this? I mean, the example has been cited. You build a school and there are no hand-washing facilities, sustainable hand-washing facilities. Go to marketplaces, stadia, and so on and so forth. Everything's wrong. Where do you think that we probably are not getting it right? Is it in terms of follow-up supervision, or just in terms of not just being aware of what to do?
So I think there's a real issue here, and it's something, you know, we're rediscovering in Britain, that it's not just about having the facilities, it's about people making it part of their routine, that before they start preparing food, they wash their hands. After they've been to the toilet, they wash their hands, that this becomes part of your habit and part of the structure of your day. And as I say, for Britain, we're relearning this. And, you know, a big part of our government communications and the communications from civil society in the last year has been around a simple slogan: hands, face, space. And this is the basic: wash your hands, cover your face when you're with other people, keep space between you. And it's that sort of thing that helps people remember or learn for the first time that this is part of their daily lives. So part of the government responsibility is about structure, but part of our mutual responsibility, whether it's in government or whether it's as a leader within our organisations or whether it's as a community leader, is about the messaging about changing habits and embedding those in people's lives. One thing I would like to say, as long as you can still hear me, is just to commend the partnership we have with Unicef on this issue. We rely on them and on our relationships with government to turn policy into practicality, and they're a fundamental part of this. So thank you to our Unicef colleague and all who work with him. But as I say, it's about culture. Thank you.
All right. Thank you so very much, Jill Atkinson, the British Deputy High Commissioner, joining us via Zoom to discuss hand washing and, of course, good hygiene. We'd like to appreciate you once again for being with us, even though we had some unstable Zoom connection at some point.
Well, I think we all live with tech challenges at times at the moment, but thank you for having me. This is a really important discussion, and I'm grateful both to Good Morning Nigeria and to the Honourable Ministers for giving this so much time. Thank you.
All right, thanks a lot. Once again, it's Good Morning Nigeria as you're watching still. We're Africa's largest television network. We have a number of tweets that have come in from our viewers on this subject matter. We'll go through those tweets now and then return to our guests. before we start getting our closing thoughts. Ibrahim Oduaji, it's getting pretty difficult for many to imbibe the culture of frequent hand washing. How can one instill the culture of hand washing in children? It's not as easy to be washing your hands regularly in a day. What makes it difficult?
That's a big question there. Now, Lowell Alpha C says, good and efficient personal hygiene rather starts with the ability of the individual to frequently wash his hands, and the benefits corroborated by the emergence of COVID-19, which hand washing is part of the ways to avert it.
Festus Akimboyewa, we need to remind ourselves that washing our hands has become critical in the fight against COVID-19. Therefore, we must all take hand washing seriously to prevent and control the pandemic. Happy Hand Washing Day.
Leo Fedeka says regular hands washing, that is crucial to eliminate infections and should be reintroduced from primary school level as in the past. Bring back hygiene and nature study, providing running water as a priority to pen humongous packages to legislators.
That's right. That's a very interesting one there. Hygiene and nature study. We used to have them in elementary school.
Sure.
In our time, hygiene, and then nature study, which was the basis of agricultural
Unfortunately, the
science.
Minister of Education was unable to be part of this discussion.
Of this conversation.
Yeah.
I think it's very significant. I don't know whether that's been incorporated now in social studies. It's not the same thing exactly as social studies. I recall, I never forgot that class when our teacher, probably, we're discussing refuse, refuse. Refuse, the same spelling, of course, is the same thing, is the verb, refuse. So it was quite confusing, trying to get the right inflection on that. Let me say, may his soul rest in peace. Now, Chris Simeon has this tweet. It says, awareness campaigns should be taken to the grassroots. Villagers, local farmers, traders, the aged, craftsmen need to be sensitized on the essence of hand washing. And also, water should be made available to speed up the process.
On the handle, Dele Major B here says the time for vigorous hand hygiene and personal hygiene education and practice is now for all levels of Nigerian population, as COVID-19 has no discrimination between the rich or the poor, medical or non-medical, military or paramilitary, employed or unemployed, thus improvements.
Mike Ayakwo, the imperative of hand washing cannot be overemphasized. The COVID pandemic has really justified the call in this regard. It's absolutely to reintroduce hygiene again and nature study in our primary schools. This will go a long way in instilling that discipline in our children.
This often been re-echoed, but it's becoming important.
There's no question about that. Yes.
Yeah, the human hand is one of the most important parts of the body that handles both clean and dirty materials, which, if not taken care of, will be a super spreader of virus diseases, namely airborne and through the contamination of food. That's coming from Suleiman Babagana.
Mutana Farouk, personal hygiene promotes good health and the longevity of one's life. Dirty hands always serve as the window through which the pathogens gain access into the human body. I urge the good people of Nigeria to strictly adhere to the mantra of regular hand washing for the safety of all. Let me throw this in. Is it also the case that perhaps as elite, the Nigerians who belong to that category do not seem to realize ultimately the hazards that they face with poor personal hygiene in general and low hand washing culture? Because yes, you can have your own washroom in your office. You can have your own washroom. Of course, you have your own washroom in your homes. You are clean. You use your hand sanitizer. But if your driver, if your office assistant, if all of those in the value chain of your environment, if they don't have access to potable water, if they don't have access to hand washing facilities, or they don't even have the habit, then at the end of the day, the big man stands the risk of being a victim of whatever pathogens are available. The Honorable Minister of Health talked about something, and I would like us to also come back to that. It's all part of what we're talking about. message and messaging, using the right channels, the right avenues. As he asks, will it be the pulpit or will it be through the imam? Will it be through the village head? Will it be through the invocation of taboos or otherwise? How do we need to communicate to our people so that you can then have, as it were, a groundswell of appreciation of precisely what we are talking about? Yes, broadcasting is good, but sometimes it says some of the adverts, they come out, they sound like jokes, they look like jokes, and the people take them like jokes. Minister of Water Resources.
Well, I think Zaid made mention to what we have. We have a tested approach now to sanitation. We call it community-led total sanitation. All the progress we have achieved with ODF, Open Defecation Free campaign in the country so far, with all the ODF, was through this process. And like I said, thousands of communities, with the work that Unicef is doing and other development partners and ourselves are doing, we have achieved quite a lot. So community-led total sanitation, we're taking it right from the community. Where we're going, but we need to work with the states, but we're targeting the communities themselves. And I have personally witnessed how we target some of these communities. A community here along Airport Road in Abuja. We went there, they had no toilet, but within 4 weeks from the activity that we did to trigger them, they had over 20 toilets in that small village. So that's the messaging that you're talking about. We have what we call community-led total sanitation. And I think if it's working like this, it's probably a tool that we can use to do other things. Then Zaid mentioned the wash comps with every community. When we trigger, we use the CLTS, and that's how we also, through that, we also develop the wash comps so that we empower the communities to do what they need to do. But like I said, sometimes there are limitations. If you provide a water scheme and there is no experts, so to speak, within the community to be able to do the routine maintenance or especially breakdown maintenance, at some point you need the authorities. And of course, a simple borehole, you're not going to come to Abuja looking for support. You're supposed to go to every local government has, they have their technical officers, they have the various departments, that are replicated everywhere. They are the ones that have the primary responsibility to deal with it. But also, I think it's very important. While we accept that government has a very important role to play, but it appears in this country that everybody wants to rely on government for everything. I think we need to ask ourselves, so what can we do? Like the PWASH program, we are trying to leverage corporate social responsibility funds. We are working with so many institutions, organizations now, Procter & Gamble, Reckitt Benckiser, they are all going to be working with us today, on this Global Hand Washing Day. So businesses, can do a lot. I marvel sometimes. I go along the road. You see so many filling stations. Look at the edifices they are putting just to sell fuel. They are wasting so much money and resources on the office building.
There are no toilets.
And no toilets.
No usable toilets.
If you can do just half of that building as an oil magnate, or as oil marketer, and take some of those blocks and go and build a toilet in a school that is close to you. Wouldn't that be better? So I think the society also needs to understand the importance of these things and to play their role. Government and the people are a partnership. Government is not supposed to replace the people, but it's supposed to guide and then we partner together so that we improve the society.
The social responsibility issue you're talking about.
Absolutely.
Now, what's your final thought on this issue?
Well, today is Global Hand Washing Day. Hand hygiene for all. And we commemorate this every year, but we should understand that it's just not a one-day event. The idea is just to remind people, to remind Nigerians of the need of their personal responsibility to take their personal hygiene a very, very serious affair, and to do all those things that are required, especially to continue to wash their hands at those critical times that they've been taught. Last year and some years before, we've been going to schools, primary schools and secondary schools. This year, we're going to a correctional facility in order to demonstrate that we should not leave, no one should be left behind. And therefore, I hope Nigerians will embrace this program, this culture of washing their hands now and forever.
Well, thank you so much. Zaid Georgie, can we have your final thoughts on this issue in about maybe 45 seconds?
So much for this opportunity. I really wish that, your station could host a wash program once a week. This is how you keep everyone on their toes. You are, leaders in this area. You can hold authorities responsible. And then if you do it weekly, this is the consistency that we need. Today is Global Hand Washing Day. Tomorrow, everyone will forget about the subject, but it is such a lively subject and should continue. And let me emphasize here, WASH is the platform for any development to happen. I'm not saying this because I'm a WASH professional, but we all know investments in WASH will make sure that the burden on the health sector becomes less because people get less sick. For education, we will have more children going to school because they are not sitting at home because they are sick. So it's a learning opportunity. And if people do not get sick, it means they will bring more income to the family. So it's a win-win situation all the way through. We need this consistency. We need this continuity. We need everyone to work together. The power of people should not be underestimated at all. We should make sure that this behavioral change that we have been speaking about cuts across. The media can play a major role. People will need to change their attitudes and practices.
All right, Zaid Georgie, Chief of WASH, Unicef Nigeria, would like to thank you for being part of our conversation this morning. Honorable Minister of Health, you want to get your closing thoughts? I want to do like Usain Bolt, do it sort of 10 seconds.
Yes, well, the purpose of hand washing is not just cosmetic. It is for disease prevention, ultimately to benefit the health of the individual, of the family, and therefore we are very much a part of it and we support it fully. It is for the good of the community, of the family, in order to keep yourself well and prevent a lot of diseases that could otherwise come to you through that.
All right. Thank you very much, Dr. Osage Hanere, Honorable Minister of Health, and Engineer Suleiman Adamu, Honorable Minister of Water Resources, and Chairman, Clean Nigeria Campaign Technical Committee. Gentlemen, we appreciate your being with us on the program today. And that does it for us on Good Morning Nigeria. We're back tomorrow, same time, 7 o'clock in the morning. Until then, take care of yourself. I'm Kingsley Osadolo.
I'm Yusuf Durabus. Monday, have a great day, and remember to observe the social distancing and stay safe.
From dusk to dawn, 24 hours a day, NTA International is with you in your living room, office, everywhere and anywhere.
Goal and Algeria settled for a 2-all draw. We'll not be done talking the Nigeria versus Tunisia international friendly without a proper analysis. With me here is a coach, the head coach of Makins Football Academy based in Abuja. Coach Benson Akimboni, thanks for coming today.
Thanks for having me here.
What did you see in yesterday's match?
I'm going to talk as a coach. I saw in that game that the coaching crew going to put